Hi everyone, thanks for tuning in. Looks like we may be having some issues with our Bell channels, so if you're able to live stream, watch on cable, or listen on the radio, that would be great. Spread the word. This morning is Tuesday, May 4th. Premier will speak first, then Dr. Patterson, then we'll get right into questions. Thank you.
Ulluminaga jawle qimay for tema chana sibulak to kali malawlo na malalong ta Patterson apatsusitakwe.
Ublatia nuva mute, ublumitakwa nuva naryata ha to 7 nguyut katin lugit. Matakwa tau 7 nuva naryaka on nertut nuvu ilwani. Man now yok takwa 85 nuva naryaka to nuvu ilwani. 83 Iqalungni, mago Kinngait takwa kansler mi mago ka aneng ilatu nuban na yo ka on nerto mamitu tana ko enak tu yo man mo tikid de gutaw takwa nuban na yo ta re kutu mi kapiyo himayu nunavut mutat he would look pa mi kapiyo himayu 16,144 amatakwa kingulia ni kapiyo himayu 12,568 takwa mago sa kapiyo himayu tu nunavut mutat Ubdumi Pigala Wutana Nunavut Iqaluit the Arctic Survival Store Matakwa Skidu Lilwit Skidu Mida Katarwe Skidu Mahanayo we Ukwinganedi Tana Ujayong in Matakwa Nang Minakatu Ukware Tako Ilo Kataulang Mat Ukwa Ratuni Ugwapunga makam ugwak tatakwa ujarayo lang matatakwa kawi magaloa tigo ukunga gakang matatakwa nang minili survival store karyok tawik matakwa skidu mo ilak katawik ama skidu lawik ugwapunga kalugmo natakwa ukwa malaw mata mana ublum pigalo ukunga niadin ama tana Iqaluit Kablunan to call low barrier shelter tan ukwa khima alang nama takwa hanayakang iluaman takwa oko taksasay ku pila katigiya botan kanu ukwe kan naktu luamang namangan Thursday ulak pa TV ku kanigaw takwa nutami ku hagak kami pakang nanak latan low barrier shelter kanu ukwe tu luang namangan takwa oko tak shelter pila katigi na tawot kana ukwe ngayon luang na mangan matana ukwa ilapeni badya malak lungatana hilat saw talaman takwa nunalid matamana kalungnit kuwe huktutane tamata tana namak to kihani takwa malitcha lawla takwa malik to koyoyut an talichich yukunita kwa kanigilo ang iluta ublaluk tang iluta kinapang mi at amato mi atok taluta aner na rangata takwa malitcha optigutan nuban na riwa ihulagata nun naman naman nunuvud mi utakwa tiliok tu chapaka ama matnasu itakwa malik takut takwa malik kuptigu kihani tanun na riwa ihulikan naman Maltakwa malik daw kuyaw yung anya talitichi kung maling ikuptigo tanan nuvan na kuya nunuvo iluan itabanya kalung ni man na luat tabong atokata na man takwa malik daw kuyaw malik sialaw lagutan na kalabiyo na kanuvan na kuya nungun naman mat daw yung hinunubon mute. Today we are reporting 7 new cases and 7 recoveries of COVID-19. There are 85 active cases in the territory, 83 in Iqaluit and 2 in Kinngait. The 2 cases in Rankin Inlet are now resolved, and there has been 50 recoveries to date since this outbreak started. To date, 16,144 Nunavut have received their first dose of the Moderna vaccine, and 12,556 Nunavut are now fully vaccinated. Effective today in Iqaluit, the Arctic Survival Store and the snowmobile repair shops are considered essential business and can remain open under the Nunavut's public health orders. The closure of these businesses was an oversight, and as soon as we realized they were not exempt, we took steps to fix this. Our apologies to everyone on this mix-up. Supporting our hunters and sustainable food security and time on the land is always one of the government's priorities. With regards to the temporary closure of the Iqaluit low barrier shelter, the government of Nunavut is actively working to help the Iqaluit society find solutions and to be able to help the vulnerable Iqaluit. These discussions are ongoing, and we are doing what we can to provide logistical and administrative support. I hope we are able to give a more comprehensive update on Thursday. Finally, the weather has been beautiful, and spring is now fully here. As many of our communities hold events and celebrations, it is critical that everyone keeps following the necessary measures. Please ensure you keep strong social distancing, follow gathering limit restrictions, and do not share food, drinks, or utensils. Nunavut, please continue to follow all public health measures. Mask up anytime you're outside your household. Wash your hands often. Stay home and get vaccinated. Thank you.
Good morning. As announced yesterday, there have been cases of COVID-19 infection diagnosed in the Northwest Territories and announced over the last 4 days. The Northwest Territories government has produced a list of events and locations where individuals may have been exposed to COVID-19. To minimize the risk of introducing COVID-19 to more communities in Nunavut, we have done the following. Anyone who's traveled from the Northwest Territories to Nunavut on or after April 28th must isolate for 14 days after they left. Anyone currently in the Northwest Territories will need to isolate for 14 days before traveling, unless they qualify for an exemption to out-of-territory isolation. And please remember that with the changes in the rules on exemptions and in-territory isolation, it is now mandatory for the entire household to isolate.
Ula sakut ipat sa nalo na taulaw nga nuwad yo anak 19 halit ninganik nunat sami ulunit sitamaw si mayuni nalo na taulaw to nunat sami gavamak kungi takwa titirasi si mayo kanwili ko tawgun nakto ne patawgun nakto nillo tay ko nuwad yo anak to ta be mini utoy na kayalin ni taman na tikiti tayo hunago nuwad yo anak 19 nunalin na singin nunavumi kuninga email ok na alaktugon kinatuin na nunat sami nga sa mayor Nunavut April 28 minik anik tailigalik ulo ni 14 nik kinatuin na man na nunat sami ito anik tailigay na kalakto ulo ni 14 nik awlalawngin ng minik kasi ani ang yaktaw si mangito ako ni asya kung Nunavut mo awlakon na naman ikaw man ako sa tawa ko kasi jaktaw tilugi malitaw gayalita ko kikko ang yaktaw ko ng mga Nunavut mi tamani anit tailing aram na naman asago beka jang ito tako ilo may katigili mga anit tailing kakayang ningin.
In Iqaluit, we continue to track an outbreak of the B117 variant. This infection has been spreading through a variety of ways, but with simple, basic measures it can be controlled. Unless it is a part of essential work, do not have visitors into your home or visit other homes. Wear a mask when you are around others who are not part of your household. Avoid gatherings. As much as possible, maintain distancing of 6 feet and get vaccinated.
Tamani kalun ni sulihaw isa palaya busa mapalaya ni nga tana B117 nuwadyo anak to. Tana nuwadyo anak siya mapalaya sa mayo at jiging itutigon. Kisa ni ukwa malitaw luti ayon nang itut awlataw gunak siya matay lititaw gunang ninga. Tayo mapimari yung ito ikanayara ang ipata pulariak tayo tailit sa ang ikatsin na ubalo asit sin na pulariak tailit sa kataritsi. Matuwas na makatalo si asit sin ni katiyakan na ito akot si lumiyo katiging itatsin ni. Katinga yun o tailit sa katalo si. Ang malupi yun nang nilima ni sin ni unga si giyak kakaswa katalo ti 6 feet ni si ganing. Ang malukapiyaw lo si.
I would also like to clarify a comment I made on how far behind the virus we were at last week's presser. These comments were interpreted as meaning that there's a 4-day backlog in contact tracing or testing, and neither of these are true. Swabs are analyzed either the day they are collected or the next day, with notification of positive results, and contact tracing happening typically within 12 hours. Contact tracing works, and I would like to take this opportunity to thank the public health staff who are doing this work, as well as the individuals who have cooperated with them. Working in partnership, we can and will get this under control. As of Monday, there were a total of 8 cases of COVID-19 at BCC. The boarding home cases are confined to staff members, and following testing of staff and clients, medical travelers were cleared to travel home. As per the current orders, they and their households must isolate for 14 days from the day they returned home.
Ang matigum nilam ni tinni tamat sumanuwa juan aktulerin mo. Tako hosri lau takatukili taulau ngatatay mga uluning sitamani kinguwak simalam ni tinni katiyaw simayuni hawi sakpalian ng mutambalo hawi sakatan ng munuwa juan aktuhangin mga ta. Tako tamaki sulingit yun. Tako suluk ko hawi sakutiyo hawi saktaw sa utigi hatak tu ulu sa inak balo haw pangani. Kawye kaktaw lutilo nuwa juan aktuhang ningin ni kamalo katiyaw yuminamnik kawye satsaw tigili hatak tu ikakait haw nalaw ningin ni. Tako katiyaw minuyun ni kawye sakatang ni atutik harunat siya ngatay mapivihang ni kuyan na may rumayakaan na hamnang itulirin ng may kanayakti at suruta hakto tamatuminga amalutay ko akikutuin na ikayom ni hatsar sa mayon. Katudya hatigilute taman na siya mapalian ni nokhaktigom naktavon. Naggadyaw minik katilugit 8 ngulaw tun nuwadyaw naktulit ikiktalok ikayok tawin mi. Tuyong mi bimitam matur bin mitako ikanayak din na nuwadyaw naktakto mini. Kaya saktaw law tilugit ikanayak din ang malo tuyong mi yuminit anna bilang sumayo tayo maangik karum naktitaw lilaw to angik kami nunalingin no. Man namalitaw gali pidyo tigilugit ay kwa Aulak to mini illu mi hatigi illu te ko anik te ligali ullu ni 14 ni tikilaw ni tikib bimini ngata ullu ngani pigarlo ni.
Further, I want to review the new isolation requirements. These apply to households with anyone who has traveled from the south on an exemption, has left Iqaluit since April 7th, or who left Yellowknife after April 28th without isolation at an isolation hub. The isolation period is 14 days from the day the traveler arrived home, and isolation periods can be extended if there is exposure to COVID-19 during the isolation period or a positive COVID test. Over the weekend, we also confirmed an outbreak of COVID-19 at the Mary River Mine. The mine now has 12 active cases on site at the moment. All individuals and high-risk contacts are isolating and doing well. Travel to and from the mine has been limited this week to assess the risk. We are monitoring the situation, and if the need arises, are prepared to send support resources. Currently, we are supporting the mine's outbreak response virtually. There is little risk to Nunavut from this outbreak, as there are no Nunavut employees on site, and Baffinland's COVID-19 protocols ensure that operations restrict contact with Nunavut communities. Thank you.
Ang maloto kasi naptitsiga kanya umayong atako ni anutana ni teligahan na mamalitaw galin ni. Tako malitaw gali ang kami o katigin no tako aulak tuminiw si mayon o kalunan nga tuminiw si mayon o tisakay tuminiw yunik. Ang maloy kalun ni aulak tuminiw yun April 7 minig. Ang baloy Yellowknife may nga si mayon minang na April 28 minig. Anit teli law katig tay kanino na bukaw makungita anit teli vimito yung mivingani. Tako anit teli katam na tulo ni 14 ni tako bulungan ni pigyarlo ni. Ang ikabi miningani tikib miningani ang ikangano. Hanutigi anitteili hattarnearmagaata akuniukannerunnaartu katiyahartuminiu patanuvatjuaner 19 limmik anitteilissamatillugu ubalunni nalunaartaune qanuvatjuarnartu taartuminiuningani pinasaarusi ununguani nalunaarsilaumiyugu searmapallianingani nuvatjuaner 19 nuluyaat uyararnearbingani uyararnearbik maanna 12 nik nuvatjuanartulik tappaani taikua kikkulimaatammalo katiyahartuminiutuinnareali anitteilititauyo hanuinginnerartaullutillu taikua tikibbiugunnarning aullarbiugunnarning uyararnearbigissulittarpitaartitausimayu tabbani pinasaarussarmi tamanna hauisartauningani ulureanarninga hauisarpallianginnarneartagu tamannaammalu palungaayarsimatsiarneartugu ikajortaugiaqaqqata ikajoriarunnarneartavu kisani maanna ikajortavu uyararnearbimmi searmaq tuliritillugi qarisaujakku qaalautikkullu ulureanartumiingittu nunavummiuni tainna searmapalliani uyararnearbimmi pijutigillugu nunavummi iqqanaayartini maanna baafinlaakkunni teikani nuvatjuarnartuqartillugu pitaqangittu nunalinniingaarsimayuni kammalu taakkua atuagaleerissimajangi taakkua aulatsinermu isulittarbiqartitsiju nunavummi nunalinnuurtailititsinermu
Ken Driscoll, EPTN National News. Dr. Patterson, the Premier covered some of this in his opening remarks. Yesterday, hunting supply stores in Iqaluit were told they were non-essential. And then by yesterday evening, that had been reversed. Considering local standards and values, that's a pretty big mistake to make. I'm wondering, what process did the health department go through to determine that these were non-essential businesses, and how did you go about reversing it so quickly?
Ketresko EPTN kunni sivulerti hausrigalaqataataraluanga ippatsartaakku angunasut tinunuverbiuhattartu matujaulaungata ammalu tamanna asitsertautalequ unnuttillugu matuiqtaungaalerssuni taakkua atuutiqammarimmata tamakkunungangunassutinu taanna tammarutaut jummarialuulaunga qanu taanna nalunaertaunangaat ammalu qanu asitsertaulaqililauqa.
There had been a number of discussions when this all started last year, and there's some degree of interpretation in some of the orders. The snowmobile shops, our legal department thought they were covered under the motor vehicle repair clause in essential businesses, but it was an oversight that in the orders that hunting stores weren't explicitly listed.
Taano hausiuhattarsimajuaqqaanini taakkua ilangagu taimaa tukiliortauhattarsimamma taakkuninga atuagarni tamakkua hamutaujarnu sanavi suulu nunasiutinut sanaviu ninginni nalunaertaussimanningimmata kisani taakkua pimmariuninginni taanna taakkua angunasuttulerinermu pijiksirautti taimaa taakkuninga titirartaussimanningimmata atuagarni.
And so that alternative interpretation, or the different interpretation and the oversight, wasn't caught until yesterday when the increased efforts were applied to enforcement, and so we took care of it overnight.
Taakkua asitsertaminiu jutikiliortaussimanninga taimaa hauijautuanga ilagijausqasiutililaortu ammalu malittaugialinnu taimaa unnua taakkua asitsertauqqauju matuingagunnalernerartaulluti.
Dr. Patterson, I'm wondering again about what qualifies for a public notice exposure. Because you put one out for the storehouse, and you put one out for the chart room, but yet there are businesses in town here in Iqaluit that have had large numbers of their staff tested for potential exposure, and we have no public warning about people who may have been in those stores. What constitutes a public warning? When do you decide to put one out? What's the minimum bar?
Taakkua qanu nalunaertauhattarniaqan uqausiqarniartillussi upattaujuminerni katijahattuminiutuinnarneri suulu teimailuujugatsi storehouse imirbingani ammalu chart room imirbingani taakkua tauiqalunni namminihartiuju amisu viuqattartu suulu katijahattuminiutuinnareli inuvatjuanartulimmi taimaa qanu pijjutiqalerigatsi uqausiqarunnarsiqattarqissi ikaniittuminiugu viqaujikkautigiaqartuti.
The threshold or the reason for putting those notifications out is when there's reasonable suspicion of higher risk exposure or transmission occurring on site and amongst general public that we can't adequately contact trace through any other means.
Kana killigi yang hawi kay guna ng mo tay pa upatta tumini utoy na hamning ni no vadyo na tulin ni uluga na tumini upata kisya ni tay mahanigi tumini uluti tako alokik kuli ma hawi ka kung nangin kutigo amalo hawi mangi kutigo kikutay kanin ng mga tatay matag nalo na sa hatak hugot tamak kuninga.
Jackie McKay, CBC News. It's my understanding that the government is using the Aqsarniit hotel to isolate people. Are you going to be treating that hotel as an isolation hub?
Jackie McKay, CBC kunni tako government ko tay kan Aqsarniit yung mibingan ni kasi si mamata ni teleview na ngani taman na suliba.
We're using it as an alternative isolation site for people who either don't have housing or have overcrowded housing. So it's similar to the hotels in the south, but it's not designed as a precautionary one for people who are traveling.
Tanay nalo na tayo sa mayo ani teleview gayam ni ngani tamak ko nga piloto mi ang kahangit tunod og balon ni ameso kayan ni lo tuno ang kami o katigino ay matsay na halo na nito yung mi vititu ngito galo kasi ani tana inigiyaw ko nalo ni nalo na tayo sa mayo ani teleview kay nalo.
I understand that a number of people from the low barrier shelter were contact traced and are now in that hotel. Can you explain who the rules around going there and who you're asking to go there?
Low barrier, what is that? What's a low
The dam
barrier?
shelter?
The dam shelter?
What does low barrier mean?
Low, anybody can go there, the shelter that closed over the weekend.
Tako ang kakangito ko mo katak tu itamak ko ako katiyaw yuminiw ningin ni tay kani ang kakangito ko mi tay kung ato yung mi mo taw sa mamatataman na lalo na yakakong nakyo.
We're offering it to individuals who've been either diagnosed with COVID-19 or have been exposed to COVID-19. So it's voluntary, and they're going there to reduce the risk of them spreading it to other individuals.
Ta nato ina uti tabukik ko tu inam no tay manalo na taw sa mayo no badyo anak ta sa maningin ni ko balo katiya hak tu mini unique tay mga sumasulot tay kanigun nato tay tay masya matit si tay likay nak si makullugi no badyo anak to hamningin ni.
Emma Tranch, the Canadian Press. Can you explain why now the entire household has to isolate, and was that the case during the Outbreak outbreak as well?
Emma Tranch, Canadian Press kun ni nalo na yay kay nalawi sumang kami o hatigili man ni teliga kalang mga ata agban itaw tay medyo giba.
This one's related, or this change is related in the orders. It's entirely related to travel. It's not about the outbreak. So it's designed to minimize the risk of introduction and spread before we even know that the introduction event has happened. There's a couple of other jurisdictions that have the same rules for travel-related isolation, and we still don't know how COVID arrived in Iqaluit in early April. But there's good reason to think if we had had these an order like this in place, it may have slowed the spread.
Taman nasi jak taw sa mayo malit taw galin ni tamak kuno nga ula katak tu no pidyo te katuin nakto tamat mga sa mapala na mo to ang itu galo ataman na sa maktelitit sinang mo tamak kuno nga si minun tay matsay na to aga hakto singin ni avito sa maview yun ni ula katak nang manit tay kay naktit sa hatan mo. Kaya mangin na tasuli ka no vadyo na 19 kaluno ng mga taman na tikilaw tiluwe propiga nga ngani kasi ani tayo may sumanang katako atalaw katataman na siyang mapalangin neksaw gayak tuminiulaw kaluangan.
The Northwest Territories is working to get doses of the Pfizer vaccine so they can start vaccinating people under the age of 18. Given how far along we are with our rollout, are you considering doing something similar?
Nunat sa amigo tayo kaputi ni Pfizer ni pilalang ata ukiulin ni 18 tunga ni kapiyo yung hakatala tilugo tayo ba ni tayo matsay na tamani pamnas mabe.
Possibly, but we haven't made up our mind yet.
Ingo tuin na kaya likisya na isumali ko tigis mangita busuli.
Dustin Matar, Nunavut News. Can you remind us what kids are allowed to do and if they need to wear masks?
Kids.
Kids, yeah.
Dastan petar nunat sa ako ni sukusi kanilo ka mga tayo kahit ilaw tigo. Matuwa si mga hatara hakan.
Younger children under 2 don't. 2 to 4, I think it says that we recommend that you try it, but not every toddler is going to be able to tolerate a mask. Older than that, they should be wearing a mask when they're out of the house, and they're under the same rules as everybody else, not mixing with people from outside of the household to minimize the spread between houses.
Tako kiuli 2 tunga ni pia kai tayo matuwa si mga hatara tungitui. Ako ali ukiuli 2 ni 4 ni atuli ko si mayavu tayo matok titaw kaswa hatta kullugi kisa ni tako ilangi so sila nalat siya hatta jangi tut sa uyugalo kisa ni tako asingin so si matuwa si mga hatara ali tayo matsay na malitaw gali ni mali hatara ali so illu miyo hatiging itamini katisi hattang illu titaman na siya mapadle ako nagwasingin illu miyo hatiging itamino.
Are you able to update us on the number of positive cases under 18?
How to go nakitigo hatsi to na mga ta ukiuli 18 tungani Nunavut ta sumayo.
Yeah, as of yesterday, it's 23.
Ipat siya ni 23 ngulaw to.
Trevor Wright, Nunavut News. I know you mentioned that you guys are supporting the mine remotely, but are there any, I guess, company healthcare workers present at the Mary River mine?
Trevor Wright, Nunavut News ko niyo hasa magabita ko yan na bikoy kayo sukabigi harisa ko khalaw tikulo tapani anna si optita haka tekunong bafen lang kun kanayak to ni.
Yeah, all remote work sites are required under Workers' Safety Compensation Commission rules, legislation, to have medical staff on site, and so we're supporting them in their work.
Ita ko maligali te kuno nga pikuyapti ko tamak kuno nga kanayapti no naliw ko maaligay ko ato agang itigo ane tulirin na may kanayapti harali te kani yaram ne binni kisani ta ko kayo sukta bo harisa yakko ukhalaw tikulo.
Does health or the GN work with any specific provincial departments down south with regards to the hubs?
Ana hamnang ituliray ko na buga pa makong ilo biliri kakalo na ni Victor Sima view unit ako to yung maybe ani daily view yung pilogi.
We're in regular contact with the public health departments in the cities that they're located.
Itay ko hay mahatigin na panle hataktang ita ko ana hamnang ituliray na mo pili review yung tay ko na ni nunali pa yam ni to yung maybe habig yatin ni.
Ken Driscoll, BTN National News. Dr. Patterson, I want to go back to Dustin's question there for a second. You answered that as of today, there are 23 people 18 or younger who have tested positive for COVID-19 in Nunavut. That number was less than 5 on Friday. That's a big difference. What accounts for that change?
Ken Driscoll, Dustin, I think 23 ngulik nakakataka, kiuli 18 ito nga ni Nunavut na tasa mayo Nunavut talima
Partly updating some data, but also in the last 5 or 6 days, there's been, what's been happening is it's moved, COVID spread from adult to adult at like essential work sites and places like that. And now it's involving a lot of the transmission that we've seen recently has been household transmission, that essential workers have inadvertently brought it into the home, and it's involving their children.
Taman na ilagay hattu tamakko no tahawarto simamata tamakko hatsiuningi. Aluna ya kutiyo ulugalaw simayuni 5 ni 6 no taman na nawadyo na 19 sama pala hatanga innam no so le khanaya bingin ni sama bimini uluting tako ya khanaya ti tema sama sila hatta ang kami hatimino kitong amino tema siago bahangit mi khanaya ga hamni mino ilangi kitong amino sama kit sila hatta to.
Dr. Patterson, I've probably asked you this one a half a dozen times in different ways, but with the news over the weekend of increased fines in various southern jurisdictions, it's probably worth asking again. They're giving out $1,000 fines in Charlottetown, $2,000 fines in Halifax, or even fining people for breaking the rules in the prairies. At what point do you think it becomes useful for Nunavut to make a deterrent like fines, financial penalties, a bigger part of your COVID response?
Luta Patterson tana piri hatta simayanga hatsiakte alokiyate makalluna na kittureerilinga ta kuninga kilekta hatta reelinin naalangittumini uyunu sulu Charlottetown me $1,000, Halifax me $2,000. Te maatu tkharayarssu review tamakko malitsiakan nerunnalle khullugi te makina yan akilit te hattarluti naalangittumini.
I think it's an option now. I think there's been some concerning behavior that we're at least considering the option of fines. But there's also some where we hear, like many people, we hear stories, you know, there was a party. Those calls need to be dealt with right away. Hearing that there was, you know, a party of 15 or 20 people on the beach at a bonfire 2 days later, there's no way to enforce that. Not after the fact.
Tanay nalirarutis sa gunnalekto taman sumalon simallaki lang at magkuninga nalat sa katangit tunit ay mga kilitit sa katanang may sumasaksiyo ta karunnak sa yagun amisu kikutuin ay kayo nang ata sulo parik to kaktumini po kalakatarluti tayo maunirlo katarluti kingunagong ito kaya mali kingunago kakto kakasulo tayo maparik to kakaya Kingu valawala kayang nga tambalo nalo na kayang kikutay kanito mini mga takawi gasto nga tayo man ukaw siriyaw chawti katarlo ti taman nato te karon nakto.
Jackie McKay, CBC News. For people who are going to the Aqsarniit Hotel, why isn't it mandatory to stay there once you're checked in?
Jackie McKay, CBC kun Aqsarniit yung mibim mo nato na sumanit tayo liga kalarin ya khalaq na khatay ko nga tuyo me vimulaw tilugi.
It's the rules for people who've been infected with COVID-19 or have been exposed to COVID-19 are the same whether they're at the hotel or in their home. They are required to isolate. If somebody is there and they wish to go back to their house, then as long as they're isolating, that's okay. In order to mandate that anybody or enforce one individual isolates because of a contagious disease, it's much more involved and requires basically keeping them at the hospital.
Tako ato agaw yuta makuno ano vadyo 19,000 mayuno tayo matsay na jigi maligalingi. Tuyo mi vimina ako ti balawang kasima na ako ti kanit tayo liga kalaki hatangata. Tayo kanito yung mi vimito hakat. Iyanit tayo ligo ti taman na kanuing ito. Kasi anang ikakumalang na ako ti kanuing gayang imiyo. Kasi ananit tayo linato ako ti ang kami ni. Tamag ko anit tayo litit sa katang na ako tayo mga nalagay haksurit nalat tawag hakatangata sulo. Unit tayo ngit si matilugan na abdalom mo.
And we need to keep in mind that the people at the hotel are there because they have nowhere else to go. or they're trying to prevent spreading it to their family and loved ones. And we're trying to support them as best we can. So they're under the exact same rules and obligations as everybody else who's expected to be isolating right now.
Kamaga hapti ko tayo ko to yung may miti tayo aseno bet sa kangin ni kung inutay kaniti tayo mata taman na lo siya makteritit sit guti yung may lamin no siya maktisit tayo lekulugin ta ko kanu to inay kayo sut siya kaswak tayo ram malo maligya hapti tayo ko nga tayo matsay nanit tayo liga ham na malit tayo kaya kakatak to ni.
Can you say what supports the government has provided to the hotel to be able to operate that facility?
Kano gava makoy kayo ka to yung may mo tayo maaulat siguro na kulugan ni tayo ligaw ng mo.
At this point, I believe we're providing supplies of personal protective equipment, and they are either or are going to be one of our the work sites that will be involved in regular surveillance swabs for COVID-19.
Mana yo tayo ko ato na yo titaw yo tamak ko nga sa pumigo tayo yo ni solo matuan ni galan nilo tayo nalo tayo kani kana yabi nga ni tako kawi isak tayo hatam ni ato no vadyo anak to hangi kalo mga ta solo migo kawi isak ko titsani no at sibiyo katang luti.
I'm a transfer to the Canadian Press. Can you give us an update on the person who was hospitalized last week, and has anyone else been hospitalized?
I'm a transfer to Canadian Press kunni tayo na ko tiga law tigo tayo na ana bila yo hanui pa malasing ini unit to kalaw ka.
For the individual who was medevaced last week, the last I heard was that they were stable, but I don't know if they're still in hospital or been discharged, and that information's a few days old. There's one more individual who's been medevaced to Ottawa.
Then hanga tayo ko tayo nak to ko lak tayo yo kanoy kung ni pala nakakta yu kisa na hayo mangita nga ani simalang mga ana bialom mi ulugalaw simalang nga ta kisa na taw kanang mi hanga tayo ko tayo nak to ko lak tayo yo hak simalang mi yo.
I'll let you decide who's best to answer this one, but you said a lot of the new cases are coming from essential workers. What's the GN doing to ensure that those workers can stay home if they need to?
Tako aguno ta misu sa mabiwala yu tako nung yakana yaka yakalakit to ni nga pala matayo no nabuga makung yakano ilyo ka tayo ko ikayok tayo hulugi so yakana yaka tungi kay na hulugi.
Department of Health is working with other departments and agencies to ensure that people are getting physical support to isolate, trying to get them food and masks, toiletries, things like that, so they do not have to go out to get supplies.
Ana hamnang ituloy ko asing ilogo makupili revingi pili khatigi itu tamakay kayok tayo hulugan iteliga hapti tayo solo nakitara hakata balo salo maksaw titara hakata tamakkuninga lumato ay tema ikayok tayo katarum naktoy.
Justin Patterson, SAC News. Following up on Jackie's questions, how many individuals is the GN isolating at the Aqsarniit right now?
Justin Patterson at SAC ni hatsi wasan nito yung mivimani teli titaw yu.
31.
Are you able to provide an update on the variant testing?
Kano ilakalitay ko tamat nanubadyo na si Jepalya yo kaw isakto katam ni.
I think we had another 20 results come back over the weekend, and the variants in Iqaluit are all B11.7. There's at Baffinland Mine, there's one B117 and another variant B1617. But we only have 2 results from Baffinland, so we don't know which one is causing the outbreak at this point.
Dako tuani kanni tikilaw to kalunani pinasakos yunungwani tamani kalumino wadyo naktaksima yu ilunatik B11.7 ay kanili nuluyani Baffinland miyataw si B117 nuwadyo naktuloy malawasing anik B1617 Tako makoy na pistimayavu bafen lami kaya mangitigunan liya tapani sa mapalyago taw mga.
Sure, right, Nunavut News. Just to clarify the previous question, the new variant, that's at Baffinland, right? Just at Baffinland? Or?
Sure, right, Nunavut News kunita nanuta asidji palyayo tay kani bafen lami to kisyani.
Yes, that's correct.
Eh.
Okay, is there anything being done to make, I guess, people less hesitant at isolation hubs to report their symptoms?
Say that again.
Is there anything being done to make people less hesitant to report their symptoms at isolation hubs?
Kano ilioto hakata ko katele hatta ko nagi kano iguti hangi kalo mga mitako na nito yung mibin kalo nani.
We continue to encourage it. We continue to work with individuals to identify symptoms as soon as possible and facilitate testing. It's a problem all over the world that some people do not want to report symptoms for fear of being shamed or punished or blamed, and so everything that can be done to reduce stigma helps as well.
Taman ayaw tuin naktakala buday ko ikayo kataot sa katakulugi tambalo nalo na sitsaw ti katakulugi kano iguti halito ako ti kambalo kaw isaktaw gumakataluti taman nakaw ngili ako ti tamani nunabjo alimami kikutuin na kapiaso mo kani mangin na nga katangata solo kang usulot ti tayo gumangimo pasiyaw gumangimo lo ambalo pasiyaw si magumangimo tayo mailang yung katayli sumong mata.
Ken Driscoll, APTN National News. Dr. Patterson, last week when we asked you about if people see others breaking the rules, you said they're to phone the RCMP. Now I'm seeing reports from municipal officials now that are saying they phone the RCMP, they get told to phone dispatch. They phone dispatch, they get told to phone the RCMP. What's your department's level of satisfaction with the RCMP's enforcement of these public health guidelines? Are they helping?
Kent Driscoll APTN ko ni pinasa ako sa yumi o kayo gabi tamak ko na alang ito sikumit siya malitaw galing ni palisik ko no kalahat ako iluti takwa lo baila ko no ilan ni ko kalabi yung ako yaw katatakho tayo ma o kala nga katakho ito inatakho kanutigi ko biyagi bigyo takwa palisik ko kayo siya katamatumong.
We've heard the same concerns. Certainly we've been working with and in communication with the RCMP for since this started. It's hard to know if, I can't really comment because I know there's been a few complaints, but I don't know how many other calls have been properly and adequately dealt with. And I believe that at least one of those concerns has gotten the attention of the Minister of Justice, who had said something like he was going to be looking into it. So, we'll continue to work with them to improve the enforcement and limit the frequency that happens.
Tana kiu ka kaya nga nalunak to kasi ni tayo matsay na sumalo ti kakatas si mayuni. To sa katas si magata kasi ni tayo palisik ko pila katigi naktang itaman na pigalaw nga ni sa ninalunat to tayo kausirilo ako nang itak kakatsi yung mga ata tayo kala kaswa katak tumini kamagiyagun naksin ng mga ata. Kasi ni tahan na ministro nga maligaligayik ko tamatumong kahawigyang na yung nakaktawlok to tamak ko malitaw galin ni malititsit siya akong nakalaw ang mga tapalisik ko mitsano.
Dr. Patterson, I'm wondering about the difference in reporting back to people with negative and positive cases. You've been saying if they have a positive, you'll hear within 12 hours. But if it's a negative, it could take as long as 48 hours. One of the best things you can hear from a doctor is, I'm not sick. Why wait 2 days to let people know they're not sick?
Dr. Patterson, tayo adigingin na kang ati kawi kataw katang ningin nabadyanak to hangin mga takawi saktaw lok tilugit nabadyanak to hangin ito yung bali nabadyanak ta si mayuit ikakay 12 to nga ni kawi kataw katak to amalo tayo nabadyanak hangigay mata 48 ikakay to nga ni Akaw na pango kayang ali kaw jawlo ni luta mo kanuingin ni kaktawlo ni sumali mako ni ulo ni utakakatakisi.
Because oftentimes, much of the time, there's more important work to be done. And many of the negative swabs are people who it's not going to change anything. They're still going to need to isolate for 14 days. It's good to know that it's negative, but they're not going to be able to leave the house if it's a negative test. So it can wait, and in some cases has to wait a few days to make that call.
Pimari naksaniya singin ni piyat sa kakatam mata piyat sa hatum marialo tilugi mana yo taman na si jiro tau jangit siyang sulo kaya sakta minyo yo ani teli titaw tilugi sulo ani teli gya kay natuin nam na ngata tay manalo na tau galo ako tinuvad jam nakto hangin ni ngani kaya kaktaw gya ko biya nakayak tau galo ano vad jam nakto hangin lo ni kasi ani ilo mi ani teli tuin nam na nga si jiro to kadjangin matay mailangin ulugalan ni utakititaw hatak to kaya kaktaw gaswarning.
Jackie McKay, CBC News. Are you considering getting help from the Red Cross for this outbreak?
Red Cross kundi kayok taw gay sumasimabi.
The Department of Health isn't. I understand that the City of Iqaluit has considered or is considering it, but we have not.
Ana hamnang ituliriyik ko tayo may kayok tayo gumasimang ito suli kasi ani sirik kong Iqaluit tayo may tuwid na kayali kasi ani tako no nabagawa makong yapirisimang ito.
Received a number of questions about custody arrangements with children who move between houses. Could you clarify on what people should do who have those arrangements?
Tako tigo nga kakay nakatakto palo kitong kami ni nalikitaw sa katakto kano taman na akiyo mo.
The courts and lawyers and public health orders are very clear that we, barring known COVID-19, the public health orders cannot interfere with parental access to children.
TV maligaliri ana hanggang ituloy na mamalitaw gali ito kasi natsatun. Nuwa Joanna 19 tahang ito akatakuan na hamnang ituloy na mamalitaw gali aber hangit siya ito tamakunungang ito nga mitamit sa ano pidyo tigilugo.
And just to be clear, if there was a case where children were going between two households and one household had COVID-19, if for whatever reason, if there was a desire to move them from one house to the other, as long as that other house was understanding and agreeable to going into isolation, we would not stand in the way of that happening.
Kasi natsatsyar luguta ko sulu hito nga kaya yun nalikitaw daw hatatilungi sulu makon ni ilumi khatigin ni khatakata ilangata nai pangailumi khataw yo nuvad Joanna tato halam nakad amalunut ti khattaw mapatatako tay may khattaw natsar to kisani to kipsi matsar luta amalo abya yang itu tay may gumayuno.
I'm a transfer the Canadian Press. Can you clarify which variant of concern the B1617 variant is at the mine?
I'm a transfer to kisinatiga ako B1617 uyam na bimi sumalon naka.
It's a variant, but it's actually not on the variant of concern list. There's not enough evidence to show that it spreads faster or causes more severe infection, unlike some of the other variants. It is the variant that's been, I believe, was first identified in India.
India?
Correct.
Tana si Jupala yun na Joanna tana sumalod na loangin na kaktaw yo amalo tukisigot itsa ni pitakangilo ang amanaw yo tema sa mga naksagun ng mga kilami yung naksako balon ni kanin madyo ako tagun ng mga tandago India mi kaya kala optominyo.
How did COVID-19 enter our correctional facilities?
Ano nuva Joanna isang nakate kung ikayok taw bitin no.
We don't know yet.
Kaya mangiti gusuli.
Isn't Patterson at Tech News? On Friday, you said that there's now community transmission in Iqaluit. I was wondering if you could remind us if we've seen community transmission in an outbreak prior to this, and how many currently unlinked cases are there in the city?
Dastan petano na sa kun ni talam yo minalo na siyo gawita man nunalin ni sa mapalalang nakaksugo kalon ni tema tan na to kisinaptiga kay na sawe khatsi bata ko na kaya mayaw ngiti na kisa magbiw ng mga ta.
I just got ulied. I think in Aviat there were a few events of community transmission. I honestly can't remember when or if we used that phrase to describe transmission in Aviat. None, I don't think we ever saw any events of it in any of the other communities.
Aviat may nunalin ni sa mapalayo minu kay napalayo yo kasi nakamalangin ito kanulatang mga kasi nasingin ni tayo nunalin ni sa mapalayo naktakas mga ito sule.
And how many unlinked cases are there currently?
Katsi bata ko kaya mayang ito na kasi magbiw ng mga ta.
As of this morning, I think there were 5.
Ula mo no tadlima walay lakaw yo.
Are you able to say how many cases have been identified in the shelters here in Iqaluit?
Kung nakikat siya mga tanong ka dyan na taas mayo tayo kanyang kahangit sa COVID ni.
Too few to report at this point.
Katsi na ulo ang ataho sa kayo nang itangi.
Jury Nunavut News. Earlier this week, the city declared a state of local emergency. Does that modify the House position in any way, or does it give it any more abilities to enforce stuff and whatnot here?
Trevor Wright, Nunavut News, kumita ba ni pinasa ako sa sidik kong Iqaluit. Dahil matuwag nak tumilang na kailang at ataman na si Jirutaw bataman ni malitaw yalin ni.
It doesn't change anything that we do. It doesn't change the public health orders. I assume it has impact on the city's ability to do their jobs or jobs. So you'd be better off asking them about that.
Dahil nalaya si Jirutaw ngito piliri at tinutang maluta ko anahan ng ito lirin ng malitaw yalin no si Jirutaw ngito. Kasi nita ko no sidik ko no piliri yalin mini piliri jutaw ko naksi walay naksaw na ang tay ko. Apari nga ako bigi akaw naksa.
Last questions for the Premier. Is there anything being done like waivers or anything like that with regards to people who can't register their vehicles or any other motor vehicles related duties?
Tako ano na siutiliriyik ko ako to siutiliriyik ko kano mana pikay nakatakon naka matumamata.
Thank you. I'm not sure if there's any waivers. I don't think there is. I think they can still operate through the phone, but I'm not 100% sure on that. Takwa license Aqsarniit nutango terawaktot Iqaluit ko ayung yakotot ta nakawi maning itakamanaw yo.
Ini chali hataw bit sa kala lunitay ko nga.